Yep. We got one last question,
Okay.
even though it's not the last question,
Okay.
but we know you got to go.
Okay. Okay. One last question.
One last question. How can we improve the integrity of rheumatology and other specialists care for individuals with autoimmune disease during pregnancy and postpartum?
Yeah. So I think it goes back to that humanity piece, right? It's the
I love
science
how you got to
and the
connect the
art.
dots.
Yep.
Okay.
You got to connect to that. So it's the science, right? So treating the illness, that's just a science, right?
Yep.
But then there's the humanity piece. So when someone is living with a chronic health condition, that can be really dehumanizing. Um, Sometimes people can feel like they are everything they're the only thing that they are is their diagnosis, because it consumes so much of their time.
Absolutely.
And so, I think medicine is doing a really great job in that their hospitals and medical schools are hiring psychologists like me that can help train medical providers to bring that humanity in. When you look at the training of medical doctors, they're not trained as therapists, they're not trained as social workers. They are trained to treat an illness.
Absolutely.
And so I think continuing that, right, having people like me and other mental health providers who can help train, who can help consult, with physicians on the emotional aspects. I try to be very intentional about making sure that I'm having community conversations with my community, with my medicine peers, about how you can integrate humanity into medicine, and it can just be the slightest thing. So I'll give you an example, and we can leave here. I Sometimes I've had to tell colleagues like, "Hey, did you realize your tone was kind of like?" Ooh, when you was talking to that patient, and oftentimes they're like, no, I didn't realize that. I was just rushing. I'm 20 minutes behind. I'm just da, 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 da. I'm like, yeah, that just sounded a little bit harsh. Put a little sweetness on it, right? Just talk. What Indiari say? Talk to her like you talk to your mama. Just just be a little sweet, right? Be nice and see the humanity. This is a person, right, who is living with a very difficult diagnosis. So I think that's like what we can continue to do, and we're doing it. I think we're making progress. There's always room for improvement,
Absolutely.
but we are making that progress, and we recognize that it's needed.
It definitely is needed, and I do probably, I not probably, I do want to say, because when I was a floor nurse, they hold you to certain times, and if you don't meet those times,
Yeah.
I'm just telling you, basically getting dinged.
Yep.
It's a problem on the floor. You know what I'm saying? So upper management put the pressure with the people that's on the floor that's seeing these patients to be like in and out, and that's not how you're supposed to do that. The patients are supposed to feel like you care for them, you have the time for them. That's why I would love my doctors at Freighter, but you're trained to be like that. So it's definitely good to have you come in to break that bridge, because a lot of those things go wrong when the upper management like, why this happened, or why this didn't get done, or the families come in and complain. It's because you have this person on a time limit.
Yes. Yeah, it's a lot of pressure. My physician colleagues, nurses, they're under a lot of pressure to, meet those numbers, make sure that people are getting what they need in a timely manner. But again, I still believe it's the small interactions. Like I use the example today where the approach that I use is any interaction that I have with the patient is therapeutic, no matter how long, how short. So like, the patient walk past the room, hey, Erica, hey, you doing all right? How's your dog? Your dog good? All right. Okay. And then, that type of stuff sticks with people.
Yeah, because you remember my dog.
You remember my dog. Or, even if whatever, you don't even have to go into all of that. But just kindness. Remember that we're all human. We're all going through stuff.
Absolutely. So before we leave, what all do you have coming up in the community?
Oh, what do I have coming up? I know in July, I am a panelist on the Proud Black Girl Conference here in Milwaukee.
Okay.
We doing something in May, aren't we? Am I doing something with you in May?
You are
May
doing
3rd.
Something. Yes.
I just can't remember what it was. But I told you I was gonna do it.
The 5th annual lupus informational.
Yes. That. And probably more to come. To be determined.
I love it. I love it. We are definitely going to drop her tags in there.
Yes.
Please be on the lookout for her tags.
Yes.
keep up with all that she has going on in the community. It was so good having you. You are so full of all of energy. You are dope. I love the way you explain things for the people that don't understand the medical terminology on the end.
Confusing.
You spoke to everybody. I'm sure somebody is going to look at this and learn from it. So thank you so much for coming on this platform.
Of course.
We are live every Wednesday at 6:30 at Lupus Has No Face podcast with your wonderful host, Savannah. And till next time, see you soon.
Bye.